Virtual Town Hall with Texas Governor Greg Abbott.
Good evening and thank you for joining us live from Austin. I'm Robert Hadlock from KXAN News in Austin, and I'll be your host tonight. Welcome to our virtual town hall meeting with Governor Greg Abbott. Governor, thank you for being here.
Thank you.
And your team of experts who are here with us tonight. These are uncertain times for all of us, and the governor and his team have dedicated the next hour to answer our questions and yours at home. We'll talk about the state response to the health crisis and what we can do to protect our families. The governor and his team have had their temperatures checked as they entered our station tonight, and we're also adhering to the 10-person rule and social distancing. Joining us here in the studio are four members of the governor's staff: Health and Human Services Commissioner Dr. John Hellerstedt, Texas Education Agency Commissioner Mike Morath, Nim Kidd, head of the Texas Division of Emergency Management, and Stephanie Muth, who is the state Medicaid director. Tonight's broadcast is being seen live and commercial-free in every Nexstar Media Group market in Texas, from Texarkana out to El Paso. In the few locations where we do not have a Nexstar station, we have shared this program with partners to make sure this information can be seen by as many Texans as possible. We have also provided access to all Texas media, a live stream of this broadcast for their websites. The program is also being broadcast on some Spanish language stations in Texas as well. Before we start with questions, the governor is going to take a few moments to update us on the very latest in Texas as we combat the coronavirus. Governor?
Thank you. Listen, first, I know that many of you are concerned, maybe scared, maybe confused. You deserve answers, and we appreciate Nexstar for providing this opportunity where we can begin to answer your questions. Second thing I want you to know is we're dealing with a very real challenge, a challenge that we collectively must respond to. Understand this, part of the confusion about this whole thing is we're dealing with an invisible danger. You know, often you can see a hurricane come in, or you can see a fire taking place, or you see a tornado, whatever the danger may be, you can often sense it with one of your senses. A communicable disease, you can't really sense. And so it's important for you to be able to make sure that you listen to what we have to convey tonight so that you are going to be prepared to respond to this challenge. I want to make sure that you know that we are prepared to help you respond to this challenge. The first instance of COVID-19, which is the official name of the coronavirus disease, the first time a Texan contracted it was on March the 4th. Since then, we now have 5 deaths. To show how fast this can move, when I made a presentation at noon today, there were 3 deaths. Now there are 5. There have been 158 people in Texas who've tested positive. This time next week, there will be thousands of people who will have tested positive. In 2 weeks, probably tens of thousands. This is a very rapidly spreading disease, but it's one that we are prepared to respond to. We've been prepared beginning in January with these officials working with federal and local officials to make sure we are ready for this, and we were ready in January before it first hit Texas in March. What we're doing now is we're focusing on testing. We've already conducted thousands of tests, but we're prepared to do 15 to 20,000 per week. And in a conference with the president today, he let us know that pretty soon we will be able to do well over 10 million in a month. And so the tests are ramping up quickly, but the main thing we're focused on right now is really the only thing we can do to secure your safety and public health in the state of Texas. And that is to contain expansion and transmission of the disease. Working together, we'll get it done. 2 quick stories, then we'll get to the questions. 1. The first time that Texas dealt with the coronavirus was when the United States military flew people who were evacuated from a cruise ship into Lackland Air Force Base. There were 91 people. 1 was hospitalized because of the exposure to coronavirus. All 91 of them are now home with their families, safe and sound. It's a great result we want to see replicated all the time. Last point. We all remember what the state of Texas went through just a couple of years ago when we responded to Hurricane Harvey. You can remember what used to be roadways turned into riverways that nobody could escape. An entire region around Harris County was inundated. And yet, even though people were homebound for weeks, what we saw was the heroism of our fellow Texans stepping up and helping each other, taking rowboats or canoe boats or kayaks, whatever the case may be, helping out their fellow Texans, and together we made it through. Together we will make it through the coronavirus also.
Governor, thank you for that. Before we really get started with the questions, I'd like to ask you, have you been tested for the coronavirus?
I have, and very importantly, I wanted to make sure that knowing that since the coronavirus in Texas has been around the state for a month, and since that time I have shaken hands with or hugged or encountered thousands of Texans. I owed it to my staff, to the people of Texas, as I lead this effort to make sure that I was tested, and I tested negative, which means I don't have it.
And what about your team here?
I don't know.
I haven't had
Anyone
any symptoms.
have
No signs and symptoms. We're checking our fever every day.
Okay, good. Well, let's update our audience now on today's developments. In a news conference this afternoon from the Capitol, the governor announced an executive order. You emphasized it's not a shelter-in-place order. All critical infrastructure will stay open in Texas. Domestic travel stays open, and your executive order includes 4 steps statewide, and they take effect at midnight Friday through midnight April 3rd. First, avoiding social gatherings of more than 10 people, no eating at dine-in restaurants, bars, or food courts, and all gyms are closed. No visiting nursing homes, retirement centers, and long-term care facilities except to provide essential care. Finally, you ordered all schools to be temporarily closed, though you encourage online options to continue children's education. Let's break down each of those statewide actions and their impact so far. First, to clarify, you said all schools, that is private schools included, and all colleges and universities. Lots of questions tonight on Twitter about this. What can you clarify?
Yes to all of that. So
Okay.
this applies to any type of educational institution. For higher education institutions, the anticipation is there will be certain aspects of the higher education location that may be open. For example, food courts at a higher education institution may be available, or students who are relying upon dining operations at the university will be able to access that. There could be other services, there could be certain exceptions. Let me give you one example, and that is you have a laboratory at a university where they're undertaking some experiment. There could be a special exception granted in a unique situation like that. Here's the way this works. My office is working in collaboration with the presidents and chancellors of all the university systems in the state of Texas to work out what will and what may not be open. You need to be in communication with the person that you work with at your university or college so you can find out what you can and cannot do. But as far as all public schools and private schools below the college level, they are closed effective midnight tomorrow.
Mike Morath from the Texas Education Agency, is there any hope that we could open our public schools before the end of May?
So the order for closure lasts through April 3rd, and we're waiting and looking at the data as it comes in. We want to make sure that first and foremost we're making public health decisions based on the best science. How do we keep our students, our staff, and our communities safe? So I think we need to wait and see how the spread of the virus unfolds and what the data tells us as we get closer and closer to April 3rd before we determine whether a longer closure might be necessary.
Could you see it going into June and July, maybe in August to complete the spring semester?
Well, for most of our K through 12 schools, they're going to be finished by early June regardless, as the normal school schedule. So again, depending upon how we see the spread of the virus, we will adjust accordingly.
Governor, you waived the STAR testing requirements this week. Will students advance to the next grade without the state assessment tests?
Yes.
Yeah, the short answer is absolutely yes. So what we've done, with, subject to the governor's leadership on this issue, is ensure that our local school systems are empowered to make the best decision for our students. We want to ensure that our students are learning and they're progressing academically, and we want to make sure that we maintain high expectations for them. But the STAR has essentially been removed from consideration. So this is the judgment of local teachers and principals as to what's the best support for each student.
If I could just add, I mean, these are unique times that call for unique solutions, and we're going to be flexible in delivering solutions that work in our society.
So high school seniors can graduate without taking the STAR?
That's exactly right.
Okay.
The seniors who have not finished passing all of their STAR tests at this point have the opportunity to demonstrate academic proficiency in other ways, and as a result can graduate as long as they have met the academic standards of their local school district.
You encourage schools to find online options to teach students. How quickly should parents be able to see this in action?
It's going to vary from school system to school system. All of our school systems are rapidly standing up options to support their families at home. I should stress this involves both online and offline, sort of high-tech and low-tech. We have a number of families around the state that might not necessarily have direct internet access today, although I should say we have a lot of internet service providers that have stepped up and are providing free internet access to families. But even if you don't have access to internet, our school systems are equipped with low-tech solutions. Think of homework packets, the thing that you and I might have gotten when we were homesick, and regular check-in calls from the teacher to mom or the teacher to the student themselves.
We have a question from Twitter tonight. What about children who depend on school lunches? How will they eat during this time? This person is especially concerned for people who live in rural areas.
Absolutely. Well, our school systems have responded to this crisis with compassion and organizational excellence that we'd expect from Texans. So over 1,000 meal service sites have been stood up as of today in communities all over the state of Texas, so that students who were dependent upon their school for lunch and in some cases breakfast still have access to that in their communities. And in fact, we have announced as of today, about an hour ago, a website where every family in Texas can find out where the closest meal site is for their kids. That is texasschools.gov. Parents can get on there and you can see, you'll click on a link that says find a meal location. Parent can type in their home address and they will find that location. I should also say that we already have 1,000 school locations where people can access food, and the first school closure was less than 7 days ago. We expect a huge number of increased meal locations in the coming days as school districts respond to this challenge.
We have a question about children, of course, home from school during this period of time while parents still have to go to work. Will the state of Texas help finding solutions for child care?
Absolutely. One thing that we already are providing is making sure that the child care operations still maintain operations. They're not either required to close down. In fact, we are urging them to remain open, and we want to implement flexibility to make sure they're going to be able to stay open. We do want to make sure, however, that there are heightened standards at the child care locations, because we don't want COVID-19 to be brought into a child care location. And so we expect heightened standards with regard to where a parent will drop off a child, limitations on visitors inside a child care unit. However, because there are going to be so many children at home who otherwise would be in school, we want to make sure that we're not losing access to the nurses, the doctors, the healthcare providers that we need to help respond to COVID-19. As a result, we're going to be working to maybe create additional child care centers that will be in close proximity to where these people are working, so it's going to be easier for them to accommodate the shift in their lifestyle with their children being at home.
Ashley Inman on Facebook asking this question tonight: what's being done for people who will not be able to afford daycare? She says not everyone will be able to sit at home. Some people have to go to work.
Well, there's a lot of different strategies. It kind of depends upon a person's circumstances. Let me give you some examples, and that is there could be unemployment opportunities. There could be reimbursements that are going to be provided by some of these federal funded programs that are being created literally as we speak over the course of this week in Washington, D.C. But there are going to be multiple pathways to make sure that we're going to be able to accommodate the unique challenges that our fellow Texans are facing, so that people who have a job will be able to continue to go to work and have their child taken care of.
All right. I have another issue to talk about, another part of the executive order that you issued today, your ban on bars and eating inside restaurants. Just how will that be enforced?
Well, there's several ways it can be enforced. One is that whether it's a restaurant or a bar, they have official authorized certificates from the state of Texas to operate. It's their license. And so there are enforcement authorities such as TABC, which has the authority to enforce bars compliance. And a bar could lose its license to serve alcoholic beverages if they violate this executive order. So literally their life as an ongoing business is on the line if they violate the order. And then in addition to that, law enforcement or with the executive order established by Commissioner Hellerstedt, he has the authority to go in and close down any of those organizations.
If people see this going on, people congregating in a restaurant, should they call 911 or what should happen?
Right now, if there's a large congregation of a group of people that exceeds the number that's talked about in the executive order, that's a potential health danger zone, and they should report it to us. We need to know about it because we as a state, really as a nation. So what I did today, I implemented the mandate that came from Washington, D.C. and CDC that mandated that we limit exposure to limit transmission of the coronavirus. And so anybody who is violating that standard is risking the health and safety of all of us. And we as all fellow Texans, we must be all in this together to make sure that you are monitoring your peers and explaining to your peers they cannot congregate in groups of more than 10 people. Otherwise, they're posing a risk to you and your health and your parents and your grandparents. So we all work together.
The best way to report it, though? Call the health department?
Yeah, call the health department would be a quick solution.
Okay. Well, this may be a question for Dr. Hellerstedt. It comes from Twitter. Bobby French in Austin saying, you are still allowing all restaurants in Texas to offer drive-through pickup and delivery services, but not temporarily closing all restaurants in Texas. Aren't you giving Texans a false sense of food safety? Do we know, can the virus be spread in food?
If the restaurant is doing the sorts of things that it's supposed to do in terms of the standards of food preparation and handling, there should be no contamination of the food with the virus or any other germ to speak of. So we believe that it's about congregation, but it's also about distance and time. So when people are in their cars, they're not exposed to one another except for the other people in the car, and they're making an order, they're driving up to window, the transaction is very fast, the food should be safe, and they're really not presenting a danger. We know that it's really important for people to have access to restaurant food, and so this is one of the best ways to do it, is to have that drive-through or take-out type of service.
Do you ever foresee a moment where we could ban drive-throughs and take-outs?
Well, we always have options in the future. We try and make sure that our activities and our actions and our recommendations are in sync with what's really happening with the situation as we see it. So the situation as we see it right now doesn't call for that. But one of the things we need to remember that it is all of our responsibility to do everything we can to keep from getting infected, to help our neighbors and our coworkers to keep from getting infected. That is what is going to drastically reduce the spread of COVID-19 in Texas.
And today we saw the Texas Restaurant Association calling for the state to defer all sales taxes for the restaurant and bar industry. Will you consider that, Governor?
We'll consider anything as we work our way through this process.
Okay. Again, these actions in place for at least 2 weeks now. What needs to happen before life begins to return to normal and Texas rolls back some of these approaches? How long before we get back to normal is the question.
Well, again, it depends on how long the coronavirus poses a problem for us. Our hope, if we do our job and we are able to contain this and bend the curve of the growth of the coronavirus, then we'll be able to get back to normal. So physically, you will be able to see where we are when you start watching the bend of the curve of the growth of the coronavirus in Texas. When it starts bending, we're getting real close to getting back to normal.
Dr. Hellerstedt, we were talking earlier off camera, that may take a while.
That's correct. So the thing we want to avoid is a very sudden, steep increase in the number of people who get sick, because a certain percentage of people who get coronavirus do get sick enough, for instance, to be in the hospital. And we want to slow that rate of growth down so that everybody who needs to have hospital care will have a bed available to do that. And that means, frankly, trading a short period of time where the virus might run its own course over and stretching it out over a longer period of time where we have the capability to cope with it the way we normally would.
Governor, would we see the economy just frozen for several months like it is right now?
Listen, this is going to be a tough economic time, but not just in Texas. You see it across not just the entire nation, but across the entire world right now. The only thing that would be tougher is if we do not take this action right now and we turn into a situation like Italy. That would be the worst case scenario. We want to prevent that from happening.
We have a Twitter question now from Luis Gonzalez, who lives in Austin. He asks, do you agree with the initial federal response to the coronavirus? Was it good enough?
Well, here, I mean, the initial federal response was to stop travel from China. And obviously that was the hot zone where it all began. And so stopping travel from China was very important. Since then, we've been working very aggressively with federal leaders, whether it be the president, the vice president, his cabinet, his staff, Dr. Fauci, Dr. Burks, they're all doing a fabulous job of advising us, but now providing us resources. We're getting so many resources for testing kits and the ability to make sure we're going to do a better job to contain this, whether it be in Texas or in other states.
How is Texas responding differently from the federal government?
Well, I mean, the state has a different role to play than the federal government. The federal government has the large, broad swath of healthcare advice through Health and Human Services and through CDC, and the states are more on the implementation side, alongside the local governments.
Kidd, how do you believe the state is responding to this at this point?
You know, we're not a stranger to disaster. We lead the nation in the number of presidential disaster declarations. We normally follow the local rule process with this. Our mayors in Texas and county judges are by state law the emergency management directors. They have experts, and when you look at the resources, the people that are closest to the problem, our local officials make those best choices. I think what we're seeing now is not just a local problem or a state problem or even a national problem, but the global problem. And that's why the governor's executive order today, I think, gives a level playing field for all of our mayors and judges to work from. We didn't take their authority away, we gave them a tighter box to be working within so we can all focus on the problem at the same time to achieve a better outcome and results.
Let's go to a different kind of business we rely on for our daily lives. It's getting haircuts, a simple thing we all need. This question coming from Amber, a KSAT 12 viewer in San Antonio via Twitter.
Governor Abbott, I am a hairstylist in San Antonio, Texas. I am self-employed and I rent a salon suite. What do we do as far as income? We're still expected to pay rent, and from as far as I know, we don't qualify for small business loans or unemployment.
Governor, what do you say to hardworking people like Amber?
Well, they fall into different categories. The type of business that she's involved in has not been shut down yet. And I don't know about her employer. I missed her employer status.
She works for herself in a salon.
But if that's so, salons have not been shut down.
Okay.
So she should still be able to earn money. But importantly, to further answer the question, there are different ways that different people who are unemployed are going to be able to access benefits. There is unemployment insurance that's available, and very importantly, I waived certain rules and regulations that would drag out your ability to access that, so you would be able to access it more quickly. In addition to that, there are other different sources of benefits, such as small business loans that could be available. Not to that particular individual, but again, that particular individual should be able to continue her trade and practice.
All right. Bruce Forbes is a small business owner in Longview. He wants to know if small businesses must lay off their employees, will the owner be liable for unemployment chargebacks, and what about insurance hikes?
Well, he's asking about business decisions, about how best to run his business, and I'm going to have to leave it to him how to make those decisions. Let me just explain it this way, and that is, our goal, if we do our job, is to make sure that he's going to be up and running sooner and back fully employing these employees.
All right. Governor, we've had a lot of questions about applying for federal disaster loans from the SBA, the Small Business Administration. When will small businesses in Texas be able to apply?
Should be hopefully as early as tomorrow, at the latest I would think on Monday. So our application to obtain those loans from the federal government is in Washington, D.C. as we speak. We're just waiting for approval from the SBA administrator.
And tonight, though, we're getting reports that the SBA's website, they're not able to do that. You're saying tomorrow will be the day?
Yeah, so the reason why they're not able to do it is because as of this afternoon, I not yet received word from the SBA that they had approved the Texas application. I'm sure they have a bunch of applications on their desk, and that's why I say I would expect it tomorrow. I don't know if they'll be working this weekend. I hope they will, and hopefully at the latest they'll have it done by Monday. Lots
of moving parts, of course. Texas, of course, has been a leader in job creation around the nation for years, and now we're facing this unemployment crisis. Are you planning changes or expansions in unemployment benefits?
Listen, we need to be prepared for everything. I don't think there's anything that has to be put on the table. I don't think there's anything that must be taken off the table. We don't know if this is going to last 2 weeks or is it going to last 10 months. And because we're dealing with these uncertainties, I think we need to maintain flexibility in how we govern to make sure we will be able to take care of our fellow Texans.
Can you forecast an unemployment rate at its worst?
I can't forecast it because we simply don't know what's going to happen. We do know there is going to be a temporary downturn. Hopefully that downturn will be only a couple of weeks long.
The state, of course, has a rainy day fund. How much is in that right now tonight?
Well, we have billions of dollars in the rainy day fund. One thing that we were successful in doing is making sure that we had a lot of money in reserve in case something like this were to arise. And we will be able to assess the situation as we move forward. But in addition to that fund, there's also a disaster relief fund in the governor's office that I have access to be able to respond to these challenges.
How much is in that?
Well, there's $150 million in that,
Okay.
but there's multiple billions in the rainy day fund that we can tap into at the appropriate time. But the appropriate time will be when we know the full extent of the challenge that we're dealing with.
Is that your sole discretion, or do you have to get the legislature back?
On the rainy day fund, that requires the legislature to act.
And you could call a special session
Sure.
to get that done. Oh, tonight, yes, sir.
Sure, go
I'd
ahead.
like to add on to that as well. The President's Emergency Disaster Declaration makes money available immediately to local governments also for the response cost of this. So while the Governor's Contingency Fund allows us to start operating and local governments can spend their money, this Presidential Disaster Declaration, we will work with all cities and counties and certain private nonprofits to receive reimbursements up to 75 cents on the dollar for all of the expenses they have. It's very important that they know that we have our website set up and they should be submitting those costs to us. They should be tracking those costs and keeping all of their receipts. That will help us turn that money around a lot faster and help us with our cash flow problems.
Keep the receipts, okay. Tonight, the price of West Texas Intermediate crude is just under $26 a barrel. That's about half of what it was a year ago. And since we're statewide tonight, let's address a question we've been getting a lot from West Texas especially. There's fear about job loss in the oil and gas industry tonight. What can the state do in terms of subsidies or other proactive steps?
Well, first, let's remember something, and that is where the price of the barrel is right now is exactly where it was in 2016. These go up and down, and so if the state were to react, every time the price of oil went down, we'd be reacting every other year pretty much. And so we need to understand that the oil sector aside, there are many sectors of our economy that are completely obliterated right now. Look at the restaurant industry, for example, or the entertainment industry, movie theaters, et cetera. So we have many sectors of our economy that are suffering mightily. That's one reason why you're seeing in Washington, D.C., all these different legislative efforts to try to respond to those challenges. That's why also the state of Texas, we will be able to begin to address this legislatively at the appropriate time when we know more about the contours of the size and magnitude of the disaster.
Turning to retail and the demands we're seeing at all the stores now, grocery stores and pharmacies are open right now virtually everywhere. Can you ensure the state will keep them open during this crisis?
Listen, I've been in constant contact with all the large retailers in the state of Texas, and they are stocked and ready to go. I know that people go to the store every single day, and I see stories every single day about people going in to get whatever they want to get and not being there. But I also know that I've talked to that particular store chain, and I know they have it in their inventory. They are restocking every single night. Some are making these accommodations that are great accommodations to allow seniors to go in for the first hour, then everybody else after that. But these stores have both the flexibility but also the supply chain to make sure they're going to be able to weather this challenge.
You don't have a fear of disruption of that chain?
Since I've been able to speak with these chains, I feel very confident about their supply chains.
Okay. We've been checking, well, last Friday you told Texans there's absolutely no need to stockpile, but we're seeing the empty shelves. And we've gone through that question. We need to keep going here with another one. This one about the Texas Attorney General's office. We've been checking in with them. The latest number we have is that nearly 1,000 complaints have been received now about price gouging in Texas. What is the AG's Consumer Protection Division doing about that?
Well, they take these complaints and then they will prosecute anyone involved in price gouging. What happens is when the governor makes a disaster declaration that authorizes the Attorney General to pursue a legal claim against anybody who will substantially increase prices just because of the crush of demand caused by an emergency situation. So a retailer that normally sells, let's say, a bottle of water for $1 can't suddenly start charging $10 for that just because there's a rush of people coming in because of a gubernatorial declared disaster. And the Attorney General has been very aggressive about prosecuting people for doing that, like in the aftermath of Hurricane Harvey, and he will in this instance also.
Are you aware of any scams on the internet or elsewhere going on?
Yes, and so there's unfortunately, along with situations like this, there are scams that arise, especially scams related to people seeking donations from you. when people are seeking donations from you, you need to check out what organization that is, if they're valid, because people out there trying to scam you out of your money. Make sure if you're donating money, you know that it's a valid organization to donate to.
Good advice. So let's address testing for COVID-19. In a news conference on Monday, you said everyone needs a COVID-19 test. We'll be able to get one by Friday. Tomorrow, of course, is Friday. Is that still the case?
Yeah, but here's the deal that people need to understand. There's a difference between everyone who wants a COVID test and everyone who needs a COVID test. And I'll let the doctor answer more about this, but I'll tell you my explanation having listened to this and other doctors, and that is the only people who need a COVID test are those who are showing signs or symptoms of having COVID-19. And there's no reason to give that test to those who are otherwise healthy. There is a singular reason why we want to test people, and that's so we can identify who has COVID-19 and isolate them so they don't communicate that disease to somebody else. We will be successful only by limiting that communication. That's the purpose of doing the test. There's no healthcare benefit to having the test run because there is no medication or medical treatment for the person who has COVID-19. But I'll defer to the doctor on all this.
Yeah, doctor, how do you determine that someone needs this test?
Absolutely. Well, as the governor said, it is really a combination of symptoms and, if you will, risk factors that need to be present. So symptomatology, what we call influenza-like illness. So it really looks like the flu. You've got that cough, fever, cold symptoms, aching, all that sort of thing. And then do you have a risk factor? So one of the risk factors could be just being elderly and having underlying medical conditions. That should qualify people to get tested. Another would be contact with a known case of COVID-19, or the other could be travel from a region anywhere in the world, including now some places in the United States, where COVID-19 is undergoing, if you will, sustained community spread. And then the final category would be persons who are hospitalized with a very severe respiratory type illness, where the other diagnostic tests that have been done have failed to reveal a definitive diagnosis. So those are the situations in which we're using testing to its best effect.
We understand from Travis County, where we are tonight, that counties have to wait for approval from the state to perform each test. So we're told there's a bottleneck. Can you talk about that process?
Well, there's two ways to access testing, if you will. One is through the public health system, and we are using the very criteria that I just described to get that testing done. Really, the system's pretty efficient. People can call the local health department, the local health authority. They can have a discussion. If the person fits those criteria and we can get a sample from them, we can get them to any one of 10 public health labs around the state that are performing the tests. And the turnaround is really once it gets to the lab, it's anywhere between 48 to at max 72 hours, because we do need to batch the tests together so that we're having the most efficient use of the testing that we have available. And again, as the governor said, the treatment for COVID-19 is supportive. So unlike some other diseases where you have a specific diagnosis and then you have a specific treatment, knowing precisely what that diagnosis is in a timely way is extremely important. Here, we don't have those specific treatments, and so we would provide that supportive care to somebody who's sick, whether they have COVID-19 or not.
How can you fix the bottleneck, though?
Well, one of the things we think is going to happen, again, is what the governor talked about, is that we'll have more testing sites around the country that private laboratories will make available, really, again, thousands of tests per week and maybe even more in a very short period of time. So we expect that to come online any day now.
If I could elaborate on that, especially in response to the way the question was asked. The question was asked about the capabilities of public health, and that's what Dr. Hellerstedt's in charge of. And there's the Public Health Authority, say in Travis County, that will provide it. Understand this, there are multiple other providers of these tests. You've seen in Austin, Texas, for example, and other communities, drive-through tests. Here it's done by a particular hospital chain. Other areas be provided by somebody else. In addition to that, through federal funding, there are now step-up facilities that have been provided in major cities across the state of Texas, where those facilities alone have the capability of testing 15,000 per week. And that's in addition to all the other private providers. So public health is just one slice of the multiple entities that can provide the collection and the testing.
What is currently the treatment for the virus itself, doctor?
Again, as I said, it's supportive care. So in other words, if somebody's ill, for instance, one of the things we recommend is that they stay home. They don't need to seek health care or even a diagnosis necessarily unless they get sicker, unless they can't take care of themselves at home. If they get to the point where they can't take care of themselves at home and need, for instance, supplemental oxygen or other types of treatments in order to maintain their bodily functions, that's the time that they're going to go to the hospital and get that supportive care. So by supportive care, that's in contrast to, say, something like influenza, for example, which in many cases we actually have very effective antiviral type drugs that can be given that really essentially shut off the reproduction of the virus. We don't have that yet in the case of COVID-19. And so what we have, again, is those supportive measures.
If you're a Texan sitting at home tonight watching this and you think you have the symptoms, what should you tell that person? What should they do?
Well,
Go ahead, sure.
really, again, if somebody has it, they should think about, was I exposed to someone that I know has it, for example. Otherwise, if they don't have those risk factors that I mentioned earlier, they should, if they can, stay at home and recover and recuperate.
Okay.
Could I add this? Because
Sure.
this is very important. This is what we've talked about a whole lot. If you think you may have COVID-19, the last thing that you should do is to go to the emergency room or to go to your doctor's office. Because if you really do have it, you're exposing others to it. If you think you have it, you should call your doctor and visit with your doctor about what the correct approach is.
Is the COVID test free?
The COVID test is going to be provided for free to anybody who qualifies for it. The qualifier is a prescription by a doctor.
Okay. In Colorado, their state health department continues reporting a daily health update, and that includes how many tests have been requested and how many have come back both negative and positive. Is Texas tracking those numbers, and will you release them?
We are doing our best to track those numbers as far as the number of tests that are being done. Right now, as the private labs are coming on board, that compiling all of that information in one place is something that we are working on.
If I could add to that, today there was a press conference with the medical team working with the president where they talked about this very issue. They stressed the importance of aggregating all this information from all these private providers of these tests and other information and make sure that it's compiled and publicly available. So that finally will come to an organized way so that it can be provided to the public.
Okay. This might be a good question for Stephanie Muth, the state Medicaid director. The state has the highest number of uninsured people in the country and has consistently declined to expand Medicaid. Potentially, this crisis will hit the uninsured the hardest. Does this give you reason to reconsider the state's position on Medicaid? That's probably a good question for you, Governor, but let me get your perspective.
Yes,
Stephanie.
Robert, thank you. I think it's really important to remember here that what we're dealing with is a public health crisis, and access to insurance is not going to resolve the immediate issue that we need to focus on. As we've all heard in the discussion tonight, the immediate issue before us is how do we prevent the spread of the virus? And that is through following the governor's executive order, listening to the advice of our public health professionals like Dr. Hellerstadt. And in the Medicaid program today, we cover 15% of Texans through Medicaid. And some of the things that we're doing in Medicaid to help protect the health and safety of those individuals, again, we were talking about if you're sick and you think you have the COVID virus, we don't want you to go into a doctor's office or an emergency room. Texas Medicaid has one of the most expansive uses of telemedicine compared to any other state in the country, and we're also adding telephonic consults as an option. So we're working diligently to protect the health and safety of those individuals that are on Medicaid.
Has this incident caused you to reconsider your stance on Medicaid expansion?
No, because the response here is one where we want to make sure, regardless of whether or not you're on Medicaid, regardless of whether or not you have access to health care insurance, you are going to be able to see if you have COVID-19, you're going to be able to go get tested for it and get treatment for it.
Okay. Well, healthcare providers are perhaps most at risk of getting COVID-19. Listen to this question from Savannah Hernsberger from Hallsville in Harrison County.
Currently, it's only been recommended that dental offices limit dental services to emergencies. We're also being asked by suppliers and employers to wear the same mask throughout the day and to limit the amount of gloves we use per patient. In order to protect patients and staff from cross-contamination and to preserve supplies for medical teams, will there be any mandates for dental offices to close?
So two sides, will the state be shutting down healthcare providers like dentists?
Yeah, there is no intent right now.
What's the state doing to keep healthcare providers the supplies that they need to stay open?
Yeah, it's something we constantly work on.
Yeah.
Obviously with a keener focus, if you would, on the healthcare issues related to COVID-19. But one thing that we do every single day, sometimes all day long, is work on the supply chain.
Dr. Elliston, do we have enough masks?
That's absolutely true. We are going, leaving no stone unturned to find all of the protective equipment that we can, and we are making steps to distribute what we have to the most critically needed circumstances. We can't wait for the day when the supply chain comes back to its normal, robust levels, but that's not here yet.
In a presidential press conference this week, it was announced about several organizations that are stepping up that are manufacturing tens of millions of masks to be used.
Just a matter of waiting for it to get here.
But it's happening very rapidly, though.
Okay. Looking back at disasters like Hurricane Harvey, some Texans are struggling with and still coping with mental health issues. Any plans for mental health resources at the state level?
Robert, I'll take that question. Okay. We have our local mental health authorities that are located across the state, and they are providing, this is a very anxiety producing time for some individuals, and mental health services are incredibly important. People can find their local mental health authority by calling 211 and locating the closest mental health authority to them. And in addition, we've been working with those mental health authorities, so when they're serving individuals who are on Medicaid, again, those tools that we talked about, the telephonic access to services, using telemedicine where it's appropriate, will be available so they can easily reach people without having to come to them.
What's being done to help medical professionals who are really getting it right now, just overworked and stressed out, really, a lot of them?
I would like to say something about that in general. One of our concerns that we want to make sure that we're vigilant about as a state is to do all we can to protect the health and safety of our healthcare workers. They're on the front lines of dealing with COVID-19. So we are extra vigilant in making sure they're being tested and evaluated and doing everything we can to prevent them from getting COVID-19. If we lose our healthcare workers, we're going to lose our ability to respond to this disease the way we need to.
Indeed. Well, with the cases expected to spike in the coming weeks, rural areas in Texas may be hard-pressed to handle all of their healthcare needs. The state of Texas has had 17 rural hospitals shut down in the past decade, Governor. Are there any plans to reopen any of these facilities?
We're going to look at absolutely all options and do whatever is both necessary and that we're capable of doing to make sure that anybody who's going to need access to health care to respond to COVID-19 will be able to get the response they need.
You spoke in your news conference today at the Capitol about possibly using hotels. What would they be used for?
Well, one thing that I did this past week is I visited with the CEOs of all the major hospital groups in the state of Texas to do basically an inventory check. How many beds do they have? What is their bed capacity? What is their excess capacity? And then what are their alternatives if they get filled up? The first alternative was medical tents. The second alternative were recently departed healthcare facilities or hospitals, of which there are an abundance of around the state of Texas. But then down the chain were hotel rooms. Hotel rooms, we've had plenty offered to the state already. That we could use because no one's going to a hotel anymore, so there's a lot of vacant hotels. And they would be used for the type of situation that Dr. Hillstead was talking about. If somebody who's been identified positive of having COVID-19, but they don't have extreme health-based issues. They need a place where they can isolate for 2 weeks in their own room with access to a bathroom, and that would allow them to convalesce and then re-enter wherever they were living before that. We want to make sure we have facilities like that across the entire state of Texas.
And that would be a low-cost solution to a big problem. Governor, our company, Nexstar, has made a priority covering real-life issues along our Texas border. You may already know this, but we have dedicated an entire website to that content called borderreport.com. Our Border Report correspondent, Sandra Sanchez, has this question from Barr in Hidalgo County.
Many South Texans living here have told me they have concerns that international bridges between Texas and Mexico will be shut down. If so, that would close trans-border commerce as well as prevent people from visiting relatives across the Rio Grande. Governor, have you asked President Trump if he's considering taking this step? If so, how do you address these concerns that Texans have?
Sure, and here's the facts that I understand them.
Okay.
And that is, if you recall earlier this week, the President announced an agreement with the Prime Minister of Canada about closing the border between the U.S. and Canada for non-essential, non-commercial activity, still allowing commercial activity to take place. It's my understanding that there may be an announcement tomorrow by the President involving Mexico. If not tomorrow, it may be coming soon, probably articulating the similar standard, and that is doing the best to close the border for purposes of cross-border traffic of people who could be bringing COVID-19 into the United States. It would be doing what we're doing here in Texas already, but still allowing commercial traffic to continue.
How would you stop the flow of people just coming across the river in rafts and whatnot?
The same way that's done every single day.
And Nim, any thoughts on protecting the border?
I think the governor said it very well.
Okay. For more on our border issues, you can go to borderreport.com. The Texas National Guard has been activated but not deployed. Can you confirm that? What's the status of that
yes,
issue today?
I can confirm because it's the governor who activates them.
Right.
And so I've been working with the general of the Texas National Guard since early February to make sure that we are on the same page plan-wise about exactly what we would do. And they are prepared to respond to different types of situations. Right now, we typically respond to requests for support, and that would be if there needs to be, let's say, a sudden pop-up of a medical facility. You could have the National Guard go in there and prop that up in one day, basically.
Okay. Here's a question from Twitter from Arthur Gonzalez here in Austin. What are the rules for funeral services? Are those on hold, or are funerals exempt from the 10-person rule?
Well, I'm going to try to recall what the CDC standards articulate, and we would urge the same. Let me convey this, and that is obviously anybody who loses a loved one, they need to be able to celebrate that life in the way that is most meaningful to them, and we want to be able to accommodate that. The best practice would be this, and that is try as best as you can to limit it to no more than 10 people. We understand you lose someone for life, and it may be impossible to do that. Let's say you cannot limit it to 10 people. Try separation practices so that you remain separated enough so that people will not be contagious to somebody else. I will tell you, it's my understanding from the CDC standard, and that is they are encouraging funeral homes to do this through online video as an accommodation.
Difficult situation.
It is a difficult situation, but we have imposed no particular restrictions on funerals.
All right. What about church services? People love going to church, a lot of us. Any implications here for weddings? It's wedding season.
Right. And another sad situation, I know a lot of people who've had to cancel weddings because of this, but there was nothing specific in the executive order about churches because there's freedom of religion here in the United States of America. But what we find almost all churches are doing, and that is the churches obviously care about the health of the people who go to their church, and they care about safety standards and societal standards. And so what we're finding most churches do, and that is to provide online services, alternative services, or seating situations that ensure they are not endangering anybody else there. Remember this, we really have one simple goal, and that's to make sure you are not going to communicate a disease to somebody else. The way to achieve that goal is to maintaining your distance from somebody else.
The primary runoff election set for the end of May. Do you support postponing that vote?
So the parties are working on this as we speak and working on agreement, and we may be making a decision as early as tomorrow out of the governor's office about what our advice is.
Any plans for a special session?
Listen, every option always remains on the table. We will continue to work our way through this. If everybody does their job and we get through this and it's done in 2 weeks, there's no need for a special session. So everyone, do your job.
We have a lot of folks in jail across Texas, everybody in tight quarters there. What's being done to protect them and their staff?
This is a top concern because you mentioned the two categories. There are the inmates and then there's the staff there. So we're working on protecting both and working for different options depending upon what happens. We obviously want to make sure that the inmates don't contract COVID-19 because if they did, it could move very quickly throughout a jail. And then in addition to that, we want to make sure that the staff doesn't contract it. And it should be, so one thing we have done is to make sure that there are no visitors to jails. So we don't want anybody importing COVID-19 to the jails. So only staff and the prisoners can be in jails. But we have strategies in the event that an inmate contracts it. We have strategies in the event that an employee contracts it. Let me be very, very clear to all employers of people who operate in jails. If you believe that one of your staff has contracted COVID-19, they need to be isolated and not exposed to anybody else at the jail. And I would recommend everybody that person came into contact with who works at the jail be tested.
So could we conceivably let people out of jail early just to relieve some of the pressure in the
It's not my recommendation.
Okay. What would you do?
Oh, there are isolation strategies where you could isolate those who are in jail who do have COVID-19. You could provide special cells for them in the same type of condition, just where they are unable to communicate that COVID-19 disease to anybody else. The same, if you would, type of holding strategy that we are using for people who are not in jail.
Governor, this is a very costly crisis for the state, a lot of money being spent. Could you foresee raising taxes in some way, sales taxes or other forms of taxation?
No.
To just try to deal with it in the budget process?
No, I mean, we have been responsible in the budget process in ensuring that we have billions of dollars in the rainy day fund to respond to it. But remember this, it's not as if Texas is an isolated entity dealing with the multitude of financial challenges here. As Nim Kidd pointed out very accurately earlier, this is now, among other things, a FEMA-based response, and there's a lot of federal funds that are flowing to help us respond to this through FEMA. In addition to that, there are all these other federal programs. And so I would say right now, money is not the problem, it's public health safety. And if everyone does their job from a public health safety standpoint, there won't be a money problem in the end.
Okay. Governor, you are around folks all day long and traveling frequently lately between Texas cities. Have you personally altered any of your routines to try to stay safe from this?
A lot of them, and it's hard for a person who's a politician, the governor of Texas. I have an impulse to shake someone's hand or to give them a hug, and so I've had to reduce my physical engagement, but also reduce the number of places that I go to. So I'm doing my part, just like I'm expecting everybody else to do their part, to make sure that we are reducing our exposure, and that's the best thing we can do right now, to make sure I'm not putting myself and you're not putting yourself in a position where you could contract COVID-19.
Dr. Ellis, really quickly, we've been hearing, don't know if it's an urban myth or not, that the warmer weather helps to reduce the chances of getting this virus. Any truth in that? We're getting warmer now this time of year.
I certainly wouldn't rely on that happening. And one of the examples that we have in the past was the 2009 H1N1 influenza virus. It actually occurred off-season, so it wasn't during the winter months, it was in the spring and the summer months. So when you get a brand new novel virus like this, and by the way, by novel, what we mean is that there's no human population that has pre-existing immunity to it, and that's what's most dangerous. It can spread very quickly. And so I wouldn't necessarily rely on the fact that summer, warmer weather is really going to curtail this.
Governor, public transportation, many millions of Texans rely on it, buses and trains and whatnot. What about restricting travel on that just to protect people from the virus?
Well, it may come to that, but not yet. The standard is that all of these public transit organizations, they need to do a comprehensive job of wiping down and cleaning out and making sure that they are not exposing any passenger to anybody who may have traveled on that particular mode of transportation to any type of bacteria or germs that could lead to contracting COVID-19.
Well, in many families, college-age children are back at home. They're at a very social age. Your daughter Audrey is home from college, we're told. And any counsel you provided her in this difficult time for all of us?
Isolate. Seriously, you can have fun in so many ways, but you need to limit the number of people you come into contact with, because I told my daughter this: you don't know if the person that you're talking to right now does or does not have COVID-19, and equally important, you don't know if that person just had a conversation with somebody else who has COVID-19, because we're dealing with a silent killer out there, and because you don't know, you need to protect yourself by limiting the amount of public interaction you have for a few weeks.
Quickly, Doctor, we saw a video of kids partying on South Padre. Bad idea, right?
Again, you don't want to be too close for too long. It's a risk.
Okay, if I could be clear, it's a prohibited idea right now.
We got about 20 seconds. You wanted to sum up.
Your public health and safety is at risk. We need your collaboration and cooperation to make sure we contain the spread of COVID-19. If we do this for just the next few weeks, we will be able to make sure we get this whole challenge behind us. Working together, we're going to keep Texas the best state in the United States.
We are out of time for this statewide television broadcast. However, we invite you to continue with us for another half hour. We'll keep talking with state officials on our live stream with many more questions like what about going to church, etc. Look to the local Nexstar station in your area, or simply go to kxan.com. Right now, Governor, thank you, and we appreciate you all coming in. Stay strong, Texas. Good night from Austin.